First of all, let me say that everybody can keep your cameras switched off and your microphones switched off for as long as the presentation is being done, and Taimur that we have with us today is presenting, and then we can stop recording at the end after the presentation, and we can have more relaxed chat without the recording in terms of any questions that you have. This is another session for the prep month that we've organized for the Cyprus Prep Point, which is the Community Information and Empowerment Center in Cyprus, providing information and support and guidance to people who choose to use PrEP, regardless of the fact that it's not yet officially available in Cyprus. So today we have with us, and it's a great pleasure to have Taimur Nouri with us, expert communicable disease prevention and control at ECDC. Welcome, Taimur.
Thank you, Christos. Thank you. Pleasure to be
So,
here.
I think that I can give the floor to you, and then after you finish with your presentation, we go on with Q&A and any questions that we may have.
Okay, perfect. So I think I will, if okay with you, close my camera to save some battery life. Is that okay?
Yes, go ahead.
Okie dokie, perfect. And then minimize here. Okie dokie. So first of all, thank you so much for inviting me to this prep month. I've seen quite a number of speakers that you have, and I feel very honored to be presenting some of the data that I'm going to be presenting today. So first of all, I have no conflicts of interest to declare. And this is going to be kind of the overview of my talk today. I'm going to start by giving you kind of an overview of the HIV epidemiology in Europe as a background to why PrEP is important. I'll then zoom in on 3 different tools that we have to support the implementation of PrEP in European countries. And I think this is quite important because you're right at the startup phase, and I really want to talk about these tools, which could be really, really important for you. But my bulk of my talk is going to be focusing on this third point, which is what does PrEP implementation look like in Europe? I'll show you some of the data that we have. We have done a recent study around knowledge, stigma in healthcare settings, and I'm not going to go through stigma issues, but I do want to talk a little bit about the lack of knowledge around PrEP in the healthcare settings, which I think is really important, and then make some final conclusions. So this is data showing you the number of people that are living with HIV in this wider WHO European region at the end of 2023. So we estimate that roughly 2.2 million people are living with HIV in this region. A third of those are living in the West, in the countries in green, 2% in the center, and 62% of those are living in the eastern parts of the region. So the true burden of HIV, of course, is in the eastern parts of the region. In the EU, on the left-hand side and the bottom there, you see that we estimate around 830,000 people are living with HIV at the end of 2023. In terms of new diagnosis, we do a joint HIV surveillance with WHO Europe, and this is the latest data from last year, showing you that we had roughly 110,000 people that were newly diagnosed with HIV in this wider European region. And again, we see that roughly a quarter of those were diagnosed in the western parts of the region, 7% in the center, and 69% in the east. And you see the rates per 100,000 at the bottom of these bubbles. And you see here a very high rate compared to the center and west in the eastern parts of the region. So the true burden, again, is in the eastern part, and that's where it's still growing. In terms of the known routes of transmission by subregion, they are quite similar for the west and center, where roughly between 40 and 43% of diagnosed cases occur among men who have sex with men, followed by heterosexual contact, both men and women, and only around 4 or 5% diagnosed cases among people who inject drugs. And this differs quite dramatically in the eastern parts of the region, where the main mode of transmission now is heterosexual, still followed by a significant proportion among people who inject drugs, and only 4% of people who are recorded as men who have sex with men. We think, of course, that this is a misclassification because of the high levels of stigma in that region, that people do not come out as being gay and therefore are recorded as either heterosexual or people inject drugs. So, but this is official statistics that we do get. A really important factor is this issue of migration, which I think we need to focus on, especially in terms of PrEP, is that a significant proportion of those diagnosed in the West are people who are born abroad, the people that we classify as migrants. So 6 out of 10 of all new diagnosed cases in the West are people, are migrants. That drops to 20% in the center, and only 2% in the eastern parts of the region are people who are born abroad. Now, digging a little bit further into this issue of migration, this looks at the proportion of HIV diagnosis in migrants in the EU, EEA countries. We see here that 56% of all diagnosis cases in the EU in 2022 were among people who were born abroad, migrants. I've highlighted Cyprus for you here. So the proportion who are migrants is higher in Cyprus than the EU average. On the top here, you see Iceland, Ireland, Czechia, Sweden. 80–90% of all diagnosed cases in 2022 were among migrants. In Cyprus, that number is around 70, a bit more than 70% of all diagnosed cases in Cyprus were among people born abroad. And what's also very important is to look at the origin of these migrants. So in Cyprus, here we have around 15–20% are from Central and other Eastern European countries, but the vast majority in Cyprus come from Sub-Saharan Africa. This looks quite different in different countries in Europe, and this is really important in terms of understanding who this population is, because then you can target interventions, especially around PrEP. We need to, since you have a significant proportion of newly diagnosed cases among migrants, over 70%, that should tell you something about the prevention programs that you need to be targeting towards. So this is really, really important. Late diagnosis is a critical issue in Europe. I'm not going to focus too much on that, but roughly 50% of all diagnosed cases in the wider European region are diagnosed late. That's with a CD4 count below 350. Men are diagnosed later than women. People in the East and Center are diagnosed later than people in the West. The older you are, the more likely you are to be diagnosed late, and heterosexual men injecting drug users are diagnosed later than other groups. So really important indicator that we have not seen enough improvement over the past decade. Okay, so moving on to guidance documents that we've done at ECDC. I don't want to talk too much about guidance. It's kind of boring, but it's really important because you're at this phase now where you're about to implement the program. ECDC does not develop guidance in terms of effectiveness of programs and stuff like that. But what we really did, which was a really nice guidance, is operational guidance, like how do we implement PrEP in Europe? And that's kind of a project we did in the middle of COVID. We published this, so it looks at some minimum standards and principles for PrEP service delivery, and we also have some case studies from different countries, 18 countries, on how they implemented, what the healthcare system looks like, what were the challenges they faced. So I would encourage you to look at this because I think you can learn a lot around that. What this does really nicely is look at some 10 core principles of an effective PrEP program. And these were developed together with community organizations, clinicians, and public health experts. And these are the 10 principles that we looked at that we think are really important when starting a PrEP program. And I think you need to look at them from your perspective. And for each of these principles, in this operational guidance, we describe why is this principle important. Engaging stakeholders, stigma-free environment. Why is this important? And then we have some minimum standards for the delivery are explained in these guidance. And what's really novel about this is that for each of these principles, we have differentiated minimum standards and they're being categorized as being relevant for pre-PrEP programs, where I would say you are newly established PrEP programs, within 2 years, and then those that have been going on for a couple of years. There should be different standards depending on where you are. So you're going to be here. So if you look at these principles from this perspective, what do we need to think about in terms of this? Do we understand who the population is we're trying to reach in our country? And if not, we tell you here how to look at that. So I strongly encourage you to look at this. It's a really nice operational guidance for how to do that. But that's all I'm going to say about it now. What we also did here in this, we had a principle around monitoring and evaluation, how important it is, but we realized it's quite technically difficult. So we actually started a separate project around this to develop a monitoring tool around pre-exposure prophylaxis. And this is a separate document, and I encourage you also to really put in place a system now at clinic level, at community level, about what is it we should be monitoring as we start this program. Very important, I think. And then Something that we're actually going to publish tomorrow or on Thursday is some standards of care. We're going to do that for pre-exposure prophylaxis and for HIV testing. Those are the first two modules that we're going to be launching. And I just want to say a few words around that. So you're the first ones to see this. It's a very helpful tool, I think. And basically the audience for this standards of care that we do together with EACTS are three. So we have community organizations, not only at European level, but at national level. So people living with HIV or people at risk for acquiring HIV, they should know, they should expect certain standards when seeking HIV prevention and care. So that's kind of an audience we're talking about here. What are those standards that you can expect to receive when it comes to PrEP in this case? From a clinical perspective, the doctors and nurses working in hospitals who are responsible for the provision of delivery of these services, and we talk about some self-auditing and the means for quality improvement, and I'm going to show you an example of that in a second. But also at policy level, both at European but also at national level, this is a really critical audience who have the responsibility for policy and guidance at national level. So these are the key stakeholders, and this is coming out in 2 days, as I said. And I just want to give you an example. It's kind of a little bit dry as well, but if you understand it, it's going to be really helpful. So these standards, so this is like an example of standard quality statements, indicators, and targets in the standards for PrEP. And in this, we've listed 6 topics that are really important in terms of certain standards. And under each topic, we've listed key indicators that we think are going to be really important. And I'm just going to give you an example. So in the annex on the access to PrEP, for example, we have a quality statement that all people at risk of acquiring HIV should be offered or have equitable access to PrEP. And then we've listed certain indicators here with the numerators, denominators, how to cache this data. And again, it's quite technical and heavy, but we've already done a first audit of this report. So the purpose of this standards is actually to do audits at clinic level, at national level, to see what does it look like? Are we achieving these standards? If not, how can we improve them? So this shows you, for example, it's kind of a detailed report, but it just shows you the percentage of people. Sorry, I can't even see this myself now. Oops. The percentage of people per clinic in the with at least 2 HIV tests within 14 months of PrEP implementation. And it shows you the clinics here and who has achieved these results. So we've hidden the names of the clinics because we're not after benchmarking here. We show each clinic that here you are, so you're at 78%, but the other clinics are doing here. And if we go through each indicator in this way, you can see how one clinic may be performing worse than other clinics. And it's not to point fingers, but it's really to improve the standards of delivery of services in that clinic. So it's a really nice tool. So again, we're going to be launching this and providing some training around this in the next couple of weeks. Okay, moving on now to implementation in Europe, which is kind of the exciting stuff. So this shows you the status of formal PrEP implementation in Europe as of the end of 2023. So we have in dark green, we have 25 countries now which have developed guidance and which have nationally funded PrEP programs. We have the further 12 countries where guidelines have been implemented but not nationally funded. We have a few countries, 5, where they've developed guidelines, but it's not implemented at all. And then there, of course, in some countries, a few countries where we have no information whatsoever. I've highlighted some countries in red here, in red circles, because these are countries where something's happened actually since 2023. We have Romania, which is going to implement the PrEP program now at smaller scale, but it's going to do that, which is really important. Greece, which have just kicked off a program, I think, in the last month, which is really exciting. And of course, in Cyprus, where you've made a decision now to implement PrEP, which is really important. So there's still movement in this area, and there needs to be more movement in this area across the region. So we ask our policymakers, what is limiting PrEP implementation? Why aren't you, what are the challenges that you're facing? And this changes year on year. But in blue, we see the countries in the EU, and the major challenges in terms of implementing PrEP is, in some countries, there's still this long waiting lists. We're going to see what happens in Cyprus, but in some countries, there's a waiting list to get access to PrEP. PrEP is not available in the whole region. It's maybe mainly in the capital or in the big cities, but it's really difficult outside those big cities to implement PrEP. And of course, one of the key issues here is reaching certain key populations that we are only reaching white gay men. And I'm going to talk about some equity issues in a second. So these are some of the barriers, and the barriers outside of the EU are mainly about stigma and discrimination, but also about reaching certain key populations. So this shows you the number of people receiving PrEP at least once in the last 12 months in 2023. So here we see all countries. We see in the UK, for example, that's the country with the highest number of people on PrEP, almost 100,000. And on the far right, here we have Cyprus, which actually there were some people on PrEP, but not in the formal sense. But these they were acquiring PrEP. Maybe they got it paid out of pocket, and then everything in between. Now we have a target in Europe that says that at least by 2025, 500,000 people should be on PrEP. That's the target. And of the data that we have, of the data countries that are able to provide data, 285,000 people have received PrEP at least once in 2023. So that's a little bit more than half. And this is 23, and this is the target for 25. So we're actually quite far away from reaching that target in Europe. So there's a lot of work to really reduce HIV incidence, and I'll come back to that shortly. But we still have a lot of work to do in terms of putting people on PrEP. As coming to issue of equity now, here we see the percentage of people. Oh, sorry. Keeps hiding here. There we go. Of women who received PrEP at least once by the end of 23. And as you see here, not all countries have data on this, and those that do, very low proportion of people who are accessing PrEP who are women. Ukraine is the country that's doing best. 28% of everybody receiving PrEP in Ukraine are women. 21% in the UK, but otherwise very low proportion. So women is a group that we are not reaching. This shows you migrants. I showed you how important the issue of migration is in Europe. The vast majority of diagnosed cases in the EU, 56%, are among migrant populations, but only these number of countries have data on who is being reached in terms of migrants or not migrants. And even in the UK, which has had a PrEP program for a very long time, a large proportion of their diagnosed cases are among migrants, but only 3% in the UK out of the 100,000 that are receiving PrEP are people who are born abroad. So we have major challenges in reaching migrant populations. So that's something that you really, and as I said, in Cyprus, I think it was around 70% of diagnosed cases last year were among migrants. So this is really a group that you need to figure out, how do we reach this group? So you need to work with migrant organizations and try and reach these populations. This shows you PrEP implementation by gender and key population in 3 countries. These are the 3 countries with the highest number of people on PrEP: UK, France, and Germany. Okay, so we see here that 95% of all people receiving PrEP in the UK were men. That increases to 96% in France, and 99% of everyone in Germany receiving PrEP are men. In terms of key populations in the UK, 87% of those receiving PrEP are men who have sex with men, only 3% migrants. They have good data, of course, in the UK. 72% of MSM in need of PrEP are covered by PrEP, which is a high proportion, I would say. That drops to 31% in terms of women. In France, only 30% of MSM are covered by PrEP, and other key populations less than 1%. And even among men who have sex with men, PrEP is largely underutilized according to France. And in Germany, they don't have broken down by only, almost 100% are men who have sex with men. They're not reaching any other key populations. Pricing is a really important issue. It's going to be interesting to see where you are able to negotiate prices, but this shows you the cost of generic PrEP as purchased by governments by the end of 2023. So we're hiding the names of the countries because it's quite sensitive information, but you see here that some countries are paying €4 a month for PrEP, and that increases to €300 a month in country X. So quite big variation. And it's important to disclose this information, I think, not by countries, but to show the wide range. And it gives you a sense, governments that can negotiate if they know that, prices vary so differently. This shows you out-of-pocket payment before and after reimbursement for PrEP in Europe. And this excludes monitoring. This is only for the drug itself. And here we see TDF, we see TDF, FTC, and Truvada, the different prices that people have to pay themselves out of pocket. So in country U, a person has to pay €200 a month to get PrEP. and you see the branded prices are really, really expensive. So again, these are barriers. So pricing is still a major barrier for the implementation of PrEP in Europe. And this is with oral PrEP, with generic oral PrEP. We are still seeing quite high prices, and it makes it very difficult for people to purchase this. And we added a question recently about the status of authorization of long-acting cabotegravir for PrEP. So this is not lenacapavir, the 2-month, two injections yearly. This is long-acting cabotegravir, which is injection every 2 months. So this was authorized by the European Commission in September 2022. 4 countries have authorized long-acting PrEP, and that's Ireland, Liechtenstein, Poland, and the UK. And 12 countries said they were planning to authorize this between the years 2024 and 2027. We don't have any numbers of people accessing this. It's quite limited, but we don't have any data on that yet. But this is something we're going to be following closely. And moving on now towards the end, we did a very important survey together with EACTS 2 years ago, trying to measure HIV stigma and discrimination in the healthcare setting. We had 18,000 respondents, fantastic results. But I'm not going to go into the stigma data, but we did have a question around the knowledge on some key aspects of HIV transmission and prevention, on concepts such as U equals U, PEP, and PrEP. And I want to show you that data. I think it's really, really important. So this shows you the knowledge of HIV transmission among in the healthcare workers when it comes to U equals U. So we provided correct statements, and we asked healthcare workers, do you agree with these correct statements or not? And 40% did not agree with the statement around U equals U. So they did not agree with that. So in this case, we assess them as lacking current accurate knowledge around U equals U. That increased to 44% when it comes to post-exposure prophylaxis, so they do not know what post-exposure prophylaxis is. And when it comes to pre-exposure prophylaxis, PrEP, 6 out of 10 of the respondents did not know what PrEP was. So clearly there's a lack of knowledge here in the healthcare setting about what these interventions are around transmission and prevention, PrEP. So we have a lot of work, and it's going to be interesting to see what your level of knowledge is in Cyprus in the healthcare setting, and how much work is going to be needed here to educate nurses and doctors and other people around what this is. I think that's going to be a key important factor for you to assess in terms of succeeding with PrEP, is you have to educate the healthcare setting. Now, we broke this down by knowledge by health professions. So not obviously, but doctors had higher knowledge on all these 3 categories compared to social workers, dental professionals, nurses, allied health professionals. What's all common in all of these is that knowledge around U equals U seems to be highest in all these categories, and knowledge around PrEP is the lowest in all these 3 categories. So there's a lot of work here to be done in terms of education. And even though doctors had the highest scores, still 1 in 3 of doctors did not know what U equals U was. Similar proportion for PEP, and 50% of doctors did not know what PrEP was. So even among those with the highest knowledge, there's still a lack of knowledge around what PrEP is. So I think that was some data I wanted to share with you. And also there is geographical differences, of course. So in Western Europe, higher knowledge around these issues compared to that in Central and Eastern Europe, but still low proportions regardless of region. Finally, I want to end with this. It's probably one of the most important impact targets we have to end AIDS by 2030 is to reduce HIV incidence, right? So this shows you HIV incidence in the full WHO European region, and this one only looks at the EU EEA countries. And the target says that we should see a 75% reduction in new infections by 2025, and a 90% reduction by 2030, using 2010 as the baseline. So this is the baseline data we have, right? And as I said, we need to see a 75% reduction by 2025. But actually what we're seeing now by 2023 is a 9% increase, not a 75% decrease, but an increase in the wider European region. We are seeing a decline in the EU, a 34% decline, which is positive, but very far away from where we should be by 2025. So we're not going to be reaching these incidence targets in Europe, Europe as a whole, but even in the EU, we're very far away from reaching this. And we have only a few years left to reach this incidence target by 2030. So this is where PrEP comes in. How do we stop new infections from happening? PrEP is not going to be the only solution, but it's going to be a very important solution So we need to think in terms of combination prevention, but this is where PrEP comes in. We need to be scaling up PrEP in order to have any chance of making indents in ending AIDS by 2030 or even beyond. So that's where this comes in. So to conclude, HIV prevention programs must be scaled up to curb the flow of new infections. That's just what I talked about, right? So it seems like PrEP is still underutilized as a prevention option across all European countries. There's inequity in PrEP implementation in Europe. It's pervasive both between countries, but also within countries. So we may exist in capitals, but outside on the countryside, it's not accessible. There's also huge inequities in PrEP implementation. Women, migrant, trans people, PWID, sex workers are not being reached, and there's still a large unmet need for MSM. So I want you to think about how you try and think about this as you implement PrEP going forward. There are major gaps in HIV-related knowledge among healthcare workers, with half of the respondents having low or no knowledge about U equals U, PEP, and PrEP. So as a community organization, you need to have a strategy for what you're going to do about this. How are you going to educate them? Because ultimately, they are going to be the ones you have to go through to access PrEP. So we have to have a program to target them. So scaling up PrEP implementation in combination with HIV testing, rapid ART initiation, and stigma reduction are going to be all crucial in order for us to have any chance of reaching these goals. And as I said in the beginning, we have some resources that could be beneficial for you as you start the implementation phase. I've talked about 3 tools that are mentioned here, and we have this capacity to provide country support. So what you need to do, Christos and colleagues, is speak with your public health colleagues, policymakers. If you want support from ECDC, the only thing we need is you to ask for it. And then we can get doctors and nurses from Jean-Michel Molina's clinic in France to come to Cyprus and have a training with your doctors and nurses on how to implement this. We can have you go to France or the UK and have an exchange between you on how to ensure that people in need of PrEP are actually accessing it, and how they did to make that happen in the UK or Norway or Sweden. So, but we need you to ask those questions. So as you think now going forward, what we're going to do, a package, a program, think about what your needs are and communicate with us and see if we can help you with those issues. So I think I'll stop there, Christos, and happy to have an informal discussion with you.
That's great, Timur. Thank you very much. Before we go into the QA, just let me say that this information is really useful for us, and thank you for the support and for being here. A clarification, the data you showed come because Cyprus is a peculiar situation. They come from the south and from the areas controlled by the Republic of Cyprus, and not they don't include data from the north side, the areas not controlled by the Republic, right?
That's well, you know what? That's a really good question. I'm assuming so, but the data comes from the Ministry of Health in Cyprus. So whatever the data they're sending us, and I'm assuming it's what you said. It's only from the I'm assuming.
I know that they are only sending the data from the areas controlled by the Republic, which is a challenge, I have to say, because people do cross, and the de facto situation in Cyprus doesn't stop people from having sex, So it's important to say that. And I'll stop now the recording so we can go ahead and have a more safe discussion